Our costs to serve our customers were increasing, and at the same time, we could see that our revenue per customer was decreasing, which meant that our margins were being squeezed. Therefore, we looked into opportunities where we could improve our efficiency, and we looked to technologies that could enable that for us.
Well, the fun thing about being a doctor is the diagnosis and the conversation with the patient and all the things revolving the patient. You know, that's what we're here for. I probably use like 30 minutes with the patient, and when I'm done examining, I have to document a journal, and it's pretty boring. I mean, to find the exact diagnose and the exact code, I mean, it doesn't really help me and it doesn't really help the patient.
We estimate that we spend roughly 10 to 15% of our entire cost base on documentation, invoicing, and reporting to databases. And we expect that to go up over the years as regulatory pressure will increase on patient safety. We decided to partner with Corti because they had a product that was far advanced and ready to go into a partnership with Capio.
Before Corti, we've experienced cases where we didn't put the right code on, and then in the end that means the company loses money when it's not going on the invoice. Getting to know Corti, I'm really positively surprised and really happy about it. It could save a lot of time.
Well, now when I'm done with the patient and I made my dictate, the system generates the code for me. It's a lot faster, a lot easier. The compliance with the doctor and the patient is better the longer time you have with the patient. And the more safe the patient feels with the doctor, there's a higher percentage of the patient actually doing what I'm telling them to do. If I get the codes from the system, I'll have more time with the patients.
What's important to us with this product is that it's easy to scale and it's easy to roll out across markets and actually get our medical users to adopt it.
I think the biggest change since implementing Corti is the transparency of the patient's case. Everybody can see the note, even if it hasn't been processed. The note is there, the codes are there. If the patient calls in, any doctor or nurse could take over the case, so the transparency is a great help for everybody.
There's a lot of possibilities for enhancing the system, making the experience between the patient and the doctor a lot easier.
I think AI can transform this industry in the sense that there are many opportunities to use voice recognition algorithms to provide decision support for doctors and nurses throughout the whole industry, providing better care and a higher quality of diagnosis across all types of medical specialties.